Well, thank you, Jesse, for to join me. Can you tell us a little bit about yourself first?
Um, um, I'm 52 years old. Uh, I'm in, fairly good condition. I do a ketogenic diet most of the time. But when I caught the virus, it was right around March 13th. And then I had a little scratchiness in my voice. And then the next day, as I woke up, that's when the virus hit me. I mean, it just out of nowhere, just in one day time. I went from just feeling tired to waking up the next day with the temperature of 103 or 104. So as time went on through the week, I've sent you pictures. You got the pictures of
Yeah.
me documenting, my temperature as the week went on. I was at one point in time. I didn't take the picture of it, but I got up to 107, and then it was 106. Then it went to 105 or 104, 103, and then about 2 days later, I was at 101, 102, right in that area. And then about 8 days, uh, the fever subsided, and I thought I was just getting over a bad flu bug. I didn't, I've heard about the coronavirus out in China, but I didn't think it was out here in March yet, spreading that fast. So I just thought I had a flu. I thought I was getting better. And then the symptoms started to reoccur with shortness of breath after that.
Okay, so you started having these upper respiratory symptoms around mid-March.
Yeah, mid-March, exactly.
Okay, with high fever above 100 and as high as 107. That's pretty high.
107, believe it or not.
Yeah, that's pretty high. Okay, and then you also told me, you showed me a picture, which I will, that you had a confirmatory positive COVID-19 test. When was that?
Yes, it was the antibody test that was done.
Mm-hmm.
And I don't know if you have that on you, but the date's on there.
Yeah,
I could pull it up real quick if you don't
it
have
was
it.
roughly. That was about, I remember it was like a week ago. So that was about late April, early March, early May.
Yeah, it was definitely probably closer to late April. I think April, maybe April 21st, 22nd, that I was confirmed with the 4-part antibody test that they gave me. That I came back positive for COVID-19 antibodies.
Okay, and and so from mid-March till right now, May. Today's May the 7th. So it's around 7 weeks already. So tell me a little bit about the symptoms and fever, starting from in March, and when did you when did you recover? How long did those symptoms last?
Well, the symptoms, I mean, they what I believe what it was, Dr. Cheng, is that out here in Colorado, they only allow you to do intravenous vitamin C every other day, 3 times a week.
Are you talking about IV or by mouth?
Yes, sir.
IV.
No, IV, 25 grams.
So they do allow you to receive intravenous vitamin C up to 25 grams each time, 3 times a week?
Yes. But in my case, I've listened to a lot of your videos, and there was one video in particular where you were dealing with patients that would try to skip their treatment.
Yeah.
And you mentioned that you observed that and symptoms would start reoccurring back as soon as they started skipping treatments.
Yes.
So what I did was I had to go from one IV place to another to get it done every day, because they're under a medical doctor and they would not let them do it every day. So I had to go from one place to another so that I can receive it 7 days a week. And when I did that, that's when I started to really feel better. Instead of 3 times a week, that wasn't enough.
Okay, let's back up a little bit. So you started having symptoms in mid-March, and when did you start receiving 25 grams vitamin C intravenously? When did you do that? Start doing that?
right at the end of March.
End of March. So about 2 weeks after having the symptoms, you started having 25 gram high dose vitamin C intravenously.
Yeah,
Okay.
it was about 2 weeks, and I
Okay.
started to get worse because I was really, I mean, I was starting to decline, you know. So I got, that's when I got on YouTube and I was looking, you know, what helps to alleviate COVID-19, and then that's when one of your videos popped up with the Andrew Saul, the Mega Vitamin Man,
Mm-hmm.
and then that's when I listened to the video, and right away I called in to see if I can get IV treatments anywhere desperately,
Mm-hmm.
and finally found 2 places at that point in time that would take me in to give me the IV treatment.
Mm-hmm. Okay, hold on a sec. Let me.
And
All right.
also, let me
Yeah.
mention this: the whole time that I was sick, quarantined in my room,
Mm-hmm.
before I can get an IV treatment, I had already watched the videos of you and Andrew Saul, and I had put my family on oral vitamin C. I told them to start taking the oral vitamin C immediately. This was about probably, I'd say, a week after I had the virus, which they
Okay.
didn't have no contact with me. I was in my room the whole time.
Uh-huh.
They would just go in with a mask and leave like water and
I see.
supplements and stuff like
No,
that for me, and
no,
I would have to get up and get them.
that was in March. So
Yes.
you start having symptoms. You suspected having COVID-19, so you isolated yourself in a room.
Well,
And
I was isolated from the beginning because
uh,
the very next day when I woke up from a fever, I never left the bed.
okay.
I stood there.
So basically, you practice the isolation in the room, and the people who took care of you would go in there with a mask only, right?
Yeah, they would go in there with the mask, and
Uh,
you know, just to be on the safe side
yeah,
because they didn't want to catch
yeah.
what we thought at that time was the flu.
Okay.
So
So so
they would just go in
when did you
and bring me.
start when did you start coming out of room? So how long were you in isolation?
I was in the room for about probably 2.5 weeks until I started to go get the treatments
Okay.
for the intravenous vitamin C,
So
which
you
was
were
right
taking.
around.
So you were taking. When did you start taking oral vitamin C?
Well, I was taking the oral vitamin C probably the first week, little after about 8 or 9 days into the COVID-19.
Uh-huh.
I didn't know nothing about vitamin C yet.
Uh-huh.
So after about 8 days being into the COVID-19, that's when I started taking it.
Okay.
And
How
like
much
I
did
said,
you
I
take?
was isolated in my room.
Mm-hmm.
My kids live with me,
Mm-hmm.
and I have a 51-year-old cousin who is kind of like our nanny, who takes care of my daughter and cleans up and stuff. But she also lives with us,
Mm-hmm.
and they were, after the first week of me being quarantined in the room, they were taking the high dose oral vitamin C, 6 to 9,000 milligrams a day.
6 to 9,000 milligrams a day. How much did you
Yeah,
take?
I I was overdoing it. I was taking like 5 or 6 thousand grams at a time because I didn't know about bowel tolerance yet.
Mm. Okay.
So as I was doing that, I was going to the bathroom a lot,
Uh-huh.
not knowing that I was taking too much at one time instead of spreading it out throughout the day.
Mm-hmm.
So as I learned more through your guys' videos, that's when I started to slow it down and take maybe 2 or 3 grams an hour instead of 5 or 6 grams every hour like I was trying the first time.
Okay. So you were taking starting from 5 6 thousand grams each time down to maybe 2 3,000 milligrams each hour.
Yeah, I was taking it was about exactly 3,000 milligrams every hour or a little after the hour that
Okay.
I started taking.
Now, how many hours per day you were taking like that?
I was doing it all day,
All
all
day.
day.
So
Yeah,
you
all day.
in
But
your waking hours.
yeah, during my waking hours, and then even at night, I would try to take it when I would have to go to
Uh-huh.
the restroom because I was drinking so much water.
Uh-huh.
I would try to take it in the evening, but as I found, it just wasn't enough to give me the speedy recovery that I wanted. So in my mind, I was thinking, I'm not getting any better. So that's when I looked into the intravenous vitamin C. And right around the end of March, March 25th or so, 26th, right around that time is when I started the intravenous vitamin C. And I started doing that every day, going from one location to another location.
Okay.
7 days a week.
So okay, let me back up a little bit, making sure we got this story right. Is that about a week or 10 days into your developing of the symptoms was fever and sometimes high fever, you started taking oral vitamin C, and when you started, it was like 5,000-6,000 milligrams per hour. And how many times a day were you taking 5,000-6,000 milligrams?
Well, I was doing that for a while, but I was noticing that it was over bowel tolerance, so I was going to the bathroom.
That's from a
a
lot.
lot. So
So
at
how many days?
This was right around March 21st, 23rd, right around that area.
Okay.
So I
so
slowed it down.
About a week.
Yeah, I slowed it down. Like I said, I
Now-
caught
now-
it March
now how many-
March 14th.
Now, how many? Because you were saying 5,000-6,000 milligrams per hour, and so when you were doing that, how many times a day, roughly a day, were you taking 5,000-6,000 milligrams?
I was trying to do it every hour.
Or you were still doing that for every hour, 5,000-6,000
I was
milligrams?
trying. Yeah, that's when I noticed it was over bowel tolerance. So I slowed it down to about half of that.
I see. So that's a lot. Now I don't know how many waking hours you were. I mean, on the average, for an average person, we're talking probably about 16, 17 hours waking hours a day. And
Yes.
if you were taking 5,000-6,000 milligrams times 16, 17 hours, I mean, times a day, that's a lot.
Yeah,
were you doing close to that?
Yeah, it was too much for me at that time.
But you were, let me make sure. So you were taking about 5,000-6,000 milligrams per hour, and maybe close to 15 times a day for a few days.
Well, yeah, it was for the first 2 days.
First 2 days.
And it was over bowel tolerance, like I said.
So you
I
start having diarrhea. Okay.
Yes.
Then
yes.
So you did that for about 2 days. Then you slow down to about half that, which is still about 7-8 times a day. Correct?
Correct.
Okay. So you were still taking 5,000-6,000 milligrams 7-8 times a day.
Yes, for the first 2 days.
Okay. And how long were you taking like that? How many days?
I did that for the first 2 days, like I said, taking it every hour when it was too much. Then after that, I slowed it down to 3,000 milligrams every hour to 2 hours.
Okay.
Right in that area.
So every hour or two, so you were taking probably 8 times to 15 times a day, something like that. And
about 10, I would say closer to 10 times a day, Doctor.
10 times a day. Okay, so 3,000 milligram each time.
Yes.
Okay, so you're taking roughly probably 30,000 milligrams a day by mouth.
Yes.
Okay. How many days did you do that?
I started my treatment right around probably, I can't remember exactly, right around the 26th or 27th. Okay. So I did that for a few days, but I wasn't getting well fast enough. That's why I went for the intravenous vitamin C treatment.
Okay, but did you feel better?
I would feel okay.
How was the fever by that time?
Well, the fever had already reduced. That's when I thought I was getting better.
Okay.
What the portion of that time I was dealing with was the shortness of breath that was kind of scaring me.
Okay, so fever was reduced, but were you still febrile? Did you still have fever?
Yeah, I still had a slight fever of like 100 to 101.
Okay.
Right in that area, 99.
But you still had shortness of breath.
Okay. Yeah, the shortness of breath is what really prompted me to start upping my doses on oral vitamin C. Okay. Like I told you, I started trying to do too much at one time. And then what happened next after that was I slowed it down to half of that for about a day or so, or maybe 2 days. And then it was like on the 27th or 28th, maybe the 25th is when I started getting intravenous vitamin C.
So you were in the late March, maybe March 20th or
Yes,
something. Okay, and you
correct.
started IVC. Okay, so you were receiving 25 grams of that's 25,000 milligrams of vitamin C intravenously a day.
A day.
And
Yes.
because some of the clinics in Colorado would give you only 3 times a week, so you were going. How many clinics did you go to receive the vitamin C treatment?
I had to go to 2 different clinics to receive it
Oh,
every day,
okay.
but I didn't. I couldn't tell.
Uh-huh.
I couldn't tell. Them that I was doing this
Yeah,
because
I
then the
understand.
medical
Yeah,
director wouldn't have let me go there. Period.
I see. Okay. So you were receiving 25 grams of vitamin C, or again 25,000 milligram vitamin C every day, and for how long?
I'm doing it till to this day.
You're still doing it today.
Yeah, but let me tell you, in between the time from
Mm, mm,
today to about I would say about 2.5 weeks ago,
mm,
I started skipping treatments. What I was doing was I thought, okay, it's been a little over a month. I can slow down my treatments, even though I wasn't feeling too good still.
uh,
And I went ahead and tried to do that, and then all of a sudden, I started feeling worse. I lost my appetite again. I was getting really tired if I would try to force myself to eat, where I would get these weak spells. So
mm,
that started to occur. And probably about, I'd say, a week and a half ago, I told the treatment center that I go to that I'm going to start. He was a really good, he's his own doctor. So he's a follower of yours as well. And I had explained to him that Dr. Cheng said that when patients would try to skip treatment, they would start reoccurring symptoms again. And he was surprised. He says, "Wow, I never knew anything like that." And I said, "Yeah." And I just want to go ahead and just keep taking the vitamin C treatments every single day from this point on.
mm,
And
mm.
this was about a week, little over a week and a half ago. And I've been doing them every day. And till this day right now, I feel 100% better.
Okay, good. So you're saying now this doctor you were talking about was able to give you every day after that?
Yes,
Oh, so
every day.
he's willing to, and you've been doing fine.
Yeah, I even went and had blood work done at the emergency room out here
Mm,
because he wanted to make sure my kidneys and my blood work were correct. So I got my
mm,
blood work done, and my blood work, my kidneys, everything came. Even my chest X-rays came back that my chest was clear.
uh-huh.
But I talked to a pulmonologist therapist,
Pulmonologist.
lung
Uh-huh.
therapist,
Uh-huh.
who had told me that maybe the COVID-19 triggered asthma attacks in me or something. But in the meantime, I just kept up with the vitamin C regardless. And till today, I feel I'm almost to that point where I'm cured, like where I don't have barely no symptoms at all.
Okay. So you've been receiving high dose vitamin C every day for the last starting about late March. So right now going on 5 6 weeks already, right?
Yeah, but in late March, Dr. Cheng, I was only getting vitamin C treatments
Hmm.
3 times a week.
I see. Okay.
You see what I'm
Okay.
saying? I was getting
Yeah.
them 3 times a week, and I did that for about a week, and then I moved to getting them every day.
Yeah.
A week later, every other day, and then I noticed my symptoms started like reoccurring back again.
Hmm.
So that's when a week and a half ago from this day is when I went to doing them every single day again and
I
didn't
see.
skip treatment.
Okay.
And that's when I'm able to eat now. I don't have no shortness of breath now.
Mm-hmm.
Um, my
And,
it's like I'm almost
and,
back to normal. I just got like a slight, small little lingering symptoms here, but
mhm.
I'm going to continue to do the vitamin C until
I see.
everything is gone.
Good, good. And also, you mentioned about you had a chest X-ray, and that was clear. That was recently, about what, 10 days ago?
That
You
was
went
done on April 17th.
April 17th, which is about 3 weeks ago. Now,
Yes.
that's the only chest X-ray you had. Did you have a chest X-ray earlier when you were in?
No, I was afraid to go to the doctors
I see.
earlier
Okay.
because I didn't want to. What I was afraid of is I was going to be put there and then
Yeah, hospitalized.
observed
Uh-huh.
And then I thought I'd rather stay home.
Okay. So April 17th, when you had a chest X-ray, the chest X-ray was clear,
Yes.
and but you still had some symptoms, lingering symptoms.
Yeah. Well, the symptoms were that it was the shortness of breath, not because I had anything in my chest, but my muscle from my breathing wouldn't let me breathe in completely all the way.
I
So
see.
that's what I mean by shortness of breath.
Okay.
So something was triggering me for not to be able to inhale, like with the deep breath all the way. It would kind of like get a
I
little
see.
tight at the end.
I see. Okay. Well, that's good. What I will do is after this video, I'm gonna put up the emails and screen share and do a short video to introduce this interview, showing those confirmatory tests
Sure.
that you get share with me. Well, and also talk a little bit about your families. Basically, you told me you were in isolation for about 7 days to 10 days, and then after that, you started going out to receive IV treatment, vitamin C. Did you at that point were you still in isolation, or you were mingling with your family members, or and the work
No.
people
Yeah.
around?
After that, I was mingling with the family while they were currently doing
Mhm.
6 to 9,000 milligrams a day.
All of
So
them.
both of my kids that were 20 years old, my son and his wife, my daughter, she's 7 years old. She was doing it as well. She wasn't doing 6 to 9,000. She was doing about 5 to 6,000.
And she's
And
7 years old. Mhm.
yes, and then my cousin, who is 51 years old,
Mhm.
she's a full diabetic,
Mhm.
was also doing about six. She was doing about 9 to 12,000 a day
Mhm.
because she was kind of worried
Mhm.
spread out throughout the day. And then also my parents came to visit me thinking that I just had the flu. They
Mhm.
didn't think it was nothing about COVID yet.
Mhm.
And after they left, I told them, you guys need to start taking the vitamin C because I think this is not the flu. This might be COVID-19.
Mhm.
So they immediately start doing the sick. They were doing about 9,000 milligrams a day, and
Mhm.
they did not get sick. My
Mhm.
mom is 72 years old.
Mhm.
She has kidney problems.
Mhm.
She's a diabetic.
Mhm.
And my stepfather, he's about 69 years old. He has coronary artery calcium deposits, so they have him on medication.
Mhm.
And he also was on the same amount, about 9,000 milligrams a day, orally
Mhm.
spread out throughout the day,
Mhm.
of vitamin C. And he did not catch COVID as well either,
Okay.
after being exposed to me for a whole
Mhm.
weekend.
Whole weekend. Okay. And how
Yes.
many? So you mentioned about a couple of people who were kind of working or living with you. How many in total?
In total, living with me, it's my daughter, my cousin, and my son and daughter-in-law. So that's four people. But my parents would always
Visiting
come
on
and
the
stay with me
weekends.
on the weekends.
In one of your emails, you mentioned. I remember you mentioned about a cancer patient. Am I right? Did I? I saw
Yeah,
some.
my brother has cancer, but he doesn't live with me.
Oh, I see. Okay.
He doesn't live here.
He wasn't.
Come over.
I see. He wasn't
He's come
exposed to.
over.
Okay.
Yeah, he's come over a couple times, but he has also taken um
Vitamin C.
high dose oral vitamin C as well,
I
Dr.
see.
Cheng.
Okay. All right. That's good to know. Well, okay. Well, basically to summarize, you not only you had a long-lasting, close to about 7 weeks of
Yes.
the symptoms, which later on proved you had a confirmatory positive COVID-19 test, proved that you had a COVID-19, and you were taking high dose oral vitamin C uh, from 5,000 to 6,000 milligrams a couple of times a day down to 3,000 milligrams, probably close to 8 to 10 times a day, and to receive intravenously vitamin C of 25,000 milligrams a day since the late March. That's a couple of times a week until about 10 days ago. You start receiving daily high dose vitamin C. 25
Yes.
milligrams, right? And
It's,
you,
it,
you you've been recovering pretty well, although you had some bumps along the way. But now you're feeling good, and the symptoms are nearly gone, and you don't have any fever anymore. Am I right?
A- Absolutely.
Uh,
And I would like to mention that I have a couple friends right now that,
uh,
um, they're on Facebook now, but at the same time that I've caught the virus, they also caught the virus,
mm-hmm,
and they are not taking vitamin C.
mm-hmm.
They are trying. They don't. I try to inform them about it, but they are going through a lot of problems right now as we speak.
So
They are having a lot of back pain, kidney pains, shortness of breath that doesn't go away. They don't know what to do. They're scared,
there's
and I
just
told them,
they're more
I'm a
they're
testimony
more
for vitamin
symptomatic.
C.
I see. Okay. They're more symptomatic than you are.
Oh
Are
yeah,
these
yeah.
are these friends? Did you hang around together when you started developing those symptoms, or I mean, were you close to
No,
them,
no,
those friends? So
no, no, no.
they got them
Yeah, they
separately.
caught it on their own.
Oh, okay, okay, they got separately. Okay, and I see. Also, you informed us you had at least two medical clinics that were willing to give 25 grams or 25,000 milligrams of vitamin C, but they were only willing to give 3 times a week. And one of them was willing to change it to daily 25,000 milligrams IV later on.
Yes,
Uh,
yes. He was willing to do it because he's a follower of yours.
oh,
And
thank you. Yeah.
when I was asking him, you know, I want to go do the treatments every day. I don't want to skip no days
Uh-huh.
now.
Uh-huh.
I'm willing to pay for it.
Uh-huh.
He was kind of worried about it because of protocol out here in the States. And I told him that Dr. Cheng said that when patients would try to skip treatments, symptoms would start to reoccur back.
Yes. Yes.
And when I told him
Let.
that, he was shocked, and he was like, "No way." I said, "Yeah." He says, "Can you find that clip for me?" I said, "Well, let me write Dr. Cheng and ask him if he can send me verification of that, or that if I can find that clip somehow, because he is really intrigued by that because he didn't know that. In
Well,
fact, he has a patient right
uh-huh.
now who had COVID and only gets the treatment twice or three times a week,
uh,
and she consistently still during the periodic treatments that she does of 2 or 3 times a week has a consistent fever of 100
yeah.
that
Well,
doesn't go away.
let me confirm that. Yes, we've seen that in patients taking oral vitamin C. Basically, COVID-19 seems to linger around much longer than a common cold, and that's
Yes.
one main feature, in my opinion. And we have seen this when people started skipping doses or lowering the doses of vitamin C, the symptoms seem to come back, and when they go back to the high dose frequent vitamin C, the symptoms seem to improve or get under control. This was also recommended among the vitamin C experts worldwide, is that we recommend people to receive high dose vitamin C, and when they stop that, don't stop right in cold turkey. Continue with oral vitamin C until you completely recover. Even after you completely recover, you want to take at least another week, which actually,
Yes.
and in my opinion, going to another issue is that in my view, and many people in the field as well, is that the chronic disease conditions, a lot of people are also deficient in vitamin C. I mean, as I mentioned, I've been taking high dose vitamin C between 5,000 to 10,000 grams milligrams a day for many years, and I never had any issues, and never had any side effects, and never had any kidney stone, any issue like that. Now let me ask you this: did you experience any other than the diarrhea, which we know, any other side effects? Any other issues with vitamin C?
No issues with vitamin C at all. What I was trying to differentiate between vitamin C and COVID was probably about 2 or 3 weeks ago, um, when I was just doing, skipping treatments, just doing them every 3 times a week instead of every day. Um, I started to have it somewhat like altitude sickness. In other words,
Yeah.
I would have a heartbeat that would race for no reason,
Hmm.
like every time I would try to go up to go to the restroom, my heart would beat really fast. And
That's common
I
feature.
didn't know,
Yes.
yeah, and I didn't know if that was from the vitamin C or from the COVID, because, you know, the doctor or the nurse who was taking care of me with the vitamin C in Loveland, Colorado, his name is Siegfried. He was saying that vitamin C doesn't do that. That might be the residual of COVID doing that to you. So
yes.
I would like to make that clear that till this day, now that I'm almost over COVID, high dose vitamin C every single day. I had, like I said, my blood work done. They checked my kidneys. Everything was fine. I had no problems, no blood issues, no reaction to vitamin C.
Yeah.
In fact, they didn't even know I was on vitamin C, because, you know, when I told them that I was doing intravenous vitamin C, they were almost to the point where they're like, well, what's that? Intravenous vitamin C? I think I heard of that before. I mean, they were pretty much clueless, and it was kind of shocking to me that doctors and nurses here at the emergency rooms don't really know much about that.
That's true. Yeah. And also, you mentioned about protocol. So, is there a statewide protocol of using high dose vitamin C? You
Is there a
mentioned
statewide?
I mean, you mentioned about the doctor was concerned about, I mean, was worried about giving you more than 3 times a week of 25 grams of vitamin C, according to the protocol. So did you imply, are you implying there is a there is a protocol that allows them to use high dose vitamin C in your state?
Yes. They have a protocol where they can only give it to you 25 grams 3 times a week.
Oh, are you able to find that protocol for me? Because I've never heard of any authority in the United States as of yet that recommends high dose vitamin C as a standard protocol yet.
It also, Dr. Cheng, might be just the discretion of the medical director
I see.
over
Okay.
it. You see what I'm saying?
I see. Basically, you were told that this is their protocol.
Yeah, that's their protocol, because they say that
it may not be the official recommendation from the board or from the state public health department or anything like that. Maybe just their local. Okay, I understand.
They're still under the influence of, you know, like textbook doctor.
I understand that.
Under here, and they think that vitamin C might be dangerous at times, too high, and I'm a testimony to that it's not.
Yeah, I know. We've seen so many patients. We've seen a lot of people receiving vitamin C. Let me also ask another question. When you were receiving these IV vitamin C treatments, were you also taking oral vitamin C at the same time, or did you stop?
I was. Like when I would get home from a treatment, I would take some ALA, alpha lipoic acid, about 2 hours afterwards to help it recirculate.
Okay.
And then probably about 3 to 4 hours after treatment, I would take about probably, I'd say, maybe, listening to you, in a glass bottle. I wouldn't put it in a plastic container or a steel container, but I would put it in a glass bottle.
Yeah.
And probably take about 2,000 milligrams every other hour.
So you were still pretty much similar, continuing your 2,000 milligram per hour kind of oral vitamin C protocol when you were at home, when you other than when you're receiving IVC treatment. You're sticking.
Yes, after treatment, about after daily treatment of 25 grams a day, about 4 or 5 hours afterwards, I would get my treatment about 12 to 1 p.m. And then probably about 4 or 5 p.m. After, you know, being at home, I would start doing 2,000 milligrams every hour to every other hour.
Okay.
Just sipping on it throughout the day.
Yes.
Till about 8 o'clock at night, and then I would stop and then go to sleep.
I see. Okay. Now let me ask you another question. Then we'll finish. I'll let you go. When you were receiving those 25,000 milligram IV vitamin C, how many hours did it last? I mean, how many hours did it take for the 25,000 milligram to go in?
The drip lasted for probably a little over an hour.
Oh, I see. So it's about close a little over an hour of 25,000 milligram. Okay.
Yes.
Well, that's good. Well, I think that you know, I got enough of this. I mean, information on this. I thank you very much, Jesse. Now, is it okay with you if I release your full name or just by your first name?
You can release my full name. That's perfectly fine.
Okay. And what I will do is I will, I'm recording this, and I will ask my IT to post on some of the video social media form, social platform, and also I will do a cover, summarizing video after this with some of the email contents. Of course, I will hide the private part. I mean, privacy issues, and particularly pointing out that you had a confirmed COVID-19. I think that's important. Test. Is that okay with you?
That's absolutely fine with me.
All right. Thank you very much, Jesse. Take care of yourself and your family, and keep me informed.
Dr. Cheng, I appreciate it. Thank you for your time as well, and I definitely will.
I'll keep in touch on the email. Thank you.
Thank you, sir.
Okay. Bye-bye.